Good morning to everyone. My name is Alberto Fuentes Losada. I am the General Technical Secretary of the Galician Ministry of Health here in the Xunta de Galicia. And in this presentation, I'm going to talk about the public procurement of innovation in our region. It is the Galician example. First of all, I would like to thank the cluster for its constant work and collaboration and its involvement in generating a health ecosystem in our region, in Galicia. And before beginning my presentation, I would also like to put the situation of Galicia in context, in figures. Galicia is located in the extreme northwest of Spain. We are 2.7 million of inhabitants with a population over 65 years of age that exceeds 25% of the total of those 2.7 million of inhabitants. In the health system, we have a budget of 5 billion of euros per year with 44,000 professionals, 14 hospitals, and almost 500 primary care health centers. And it's in this context that Galicia considered that it should bid on the public pursuit of innovation. In this slide, we reflect what are the benefits of public procurement of innovation, PPI. The public procurement of innovation improve the public health services, incorporating innovative goods or services, at the same time achieving administrative modernization and greater value in the provision of the service. It's a good way to obtain products, services, or supplies that don't yet exist on the market. Improves also business competitiveness and fosters innovation, mainly in small and medium-sized companies. And also it is an incentive for there to be cooperation between the administrations, public administrations and companies, and also for the reactivation of growth of the economy, promoting internationalization and commercialization, often using the local and regional market as a reference customer. And what are the keys for implementation from the PPI? It's very important the institutional leadership, establishing a cultural change in the public sector. Also the permanent political commitment and long-term vision, because the public procurement of innovation is a long procedure and is it's not coincided with the legislative term in political terms. Also, the capacities in human capital for the development of the PPI involving a large number of professionals in the organization. The structure is an institutional support structure for the PPI, measurement and dissemination of successful cases, the sector commitment to implement the PPI, the economic incentives, for example, European funds. The role of the private sector is very, very important, and also the definition of a model for the exploitation of developments, for example, the royalties. What is the legal framework? We have two directives of the Parliament and the Council, the Directives 23 and Directive 24. Also our law of public sector contracts, the Law 9 2017, and also the Law of Science, Technology and Innovation, the Law 14/2011. And the different stages are very important for us. Define very good the different stages in the PPI process. The first stage is the planning. Is very important because in this stage we foster strategic vision and innovation, identify the innovative opportunities, specify the needs and identification of potential solutions, and also prepare and formulate. In short, it is necessary to define the objectives and challenges to be achieved. It is necessary to identify the needs that have to be resolved with the PPI, define the solution and identify the relevant actors, map of early demand, analyzing the market exhaustively and see which its dynamics, non-regulated procedure. If all the necessary information is not obtained for the realization of the aforementioned map, we need to use the preliminary consultation with the market. The stage 2 is very important also, is the management, beginning of the purchase process, choice of the PPI procedure and the rights of intellectual property. The specifications are drawn up and the procedure is processed until the adjudication and the perfection of the contract. And in the stage 3, is very important to monitorize and evaluate. In this phase, the execution of the contract is controlled, the impact is evaluated and analyzed, and the reports are prepared. Stage 1, clarification, planning. This is the pre-contractual activity. Define the work team within the entity, map of agents, directors, subdirectors, health professionals, management team, external agents, for example, the innovation ecosystem. Identify, prioritize, and plan purchasing needs, prepare the functional needs document, consult the market, obtain proposals for innovative solutions from the market, carry out the technical dialogue between supply and demand, and also generate of the early demand map. An example of the consults of the market, preliminary inquiries to the market. The purpose is prepare the tender and its planning, inform about the contracted plans and requirements, use advice during the tender procedure in order to receive preliminary ideas of what could be innovative and differential solutions for the need of the administration. Promote the participation of natural or legal persons to identify innovative proposals. The legal framework, they are incorporated for the first time in our case, is the Article 115 of our law. And the requirements, there are 3 important requirements. Publication in the contractor's profile and public dissemination, motivating why of the consultation. Never reveal the solutions proposed by the participants, and issue a report at the end of the consultation, which must be motivated and will form part of the contracted file. In the stage 2, we need to choose the procedure. We make a question, and do we have enough knowledge of the market to define the technical prescription? If the answer is no, we need to go to the preliminary inquiry to the market. And if the answer is yes, we use the procedure with direct choice. The second question is, we need R&D before the procurement procedure. If the answer is no, we need to ask if the technical prescriptions can be defined. If the answer is yes, the tender procedure with negotiation is the best procedure. And if the answer is no, the best procedure for that is competitive dialogue or any other ordinary procedure. Other question is, we need R&D. Yes, we need to ask ourselves whether or not we want to acquire the innovative product within the same procedure. If the answer is yes, we need to partnership for innovation procedure. And if the answer is no, we need to do the pre-commercial contracting. In the next slide, different modalities of PPI. Pre-commercial purchase is the first one. And the second one is the partnership for innovation. In this case, we need our R&D, develop and contracting on a commercial scale of new products of service, the research and the product we need. The third one is the tender by negotiation, work, service or supplies contracted including elements of adaptation, design and innovation that make contracting without negotiation inappropriate. It is necessary for the contracting authority to specify from the outset the characteristics of the goods and service to be contracted. And the fourth one is the competitive dialogue. In this case, work, service or supply is contracted after a dialogue with the buyers. Here, there are no predetermined technical specifications, and each buyer submits an offer based on their solution for the needs that the administration has defined. It is used, this procedure, for large and complex projects. And the last stage is the evaluation. Finally, in this stage, the results obtained in the PPI project and during this stage it is essential to carry out the following activities: design of monitoring mechanisms, preparation of evaluation guides and indicators for all projects. Also, evaluate the results obtained, analysis of the impact of the PPI on business and economic activities through analysis of technical dialogue with data, PPI technical workshops, or survey of companies award the PPI process. Dissemination of the results obtained, participation by the Ministry of Health on more than 40 events to promote and disseminate the PPI, both regionally, nationally, and internationally. For example, Berlin, Brussels, Oxford, Dublin, and Colombia. And finally, preparation of the document is very important of lessons learned and good practices. And this is the process of public purchase of innovation in our system, in the Galician health system. The first one is the innovation plan to give life to the hospitals of the future with around 45 million of euros. The second one is the innovation plan focused on patient-based care, with another one 45 million euros. The third one is the innovation plan focused on life, active aging and empowerment, with 13 million euros. The fourth one is the innovation plan in the field of management of biomedical research studies, with more than 6 million euros, and the future is open to new innovation plans. This is the first PPIs in Galicia, the Innova Saúde and Hospital 2050. We have 45 million euros in the first one, and 45 million euros also in the second plan, with 12 PPI tenders in Innova Saúde and 21 PPI tenders in Hospital 2050. There are 14 projects in Innova Saúde and also 9 projects in Hospital 2050. In the second PPIs in our region is Código 100, and what about that? What about Código 100? Is an innovation plan based on an agreement established between the Galician Healthcare Service, Sergas, and the Spanish Ministry of Economy and Industry, with 80% of European funds funded in the Spanish operating program for intelligence growing, called POCINT. And in this PPI, in Código 100, there are 3 main lines with 13 million euros. The first one is the patient empowerment, with 4 million euros. The second one is advances therapies, with 5 million euros, and the third one is professionals skills, the knowledge management, with other 4 million euros. Examples with the modalities of PPI with Código 100. The preliminary market consultations, so different formats, workshops, talks, conferences, and contractor profile between April and May in 2017. For an example of pre-commercial purchase, the file development, service, and demonstration phase of biomarkers for early diagnosis, response prediction and monitoring in patients with pathology related to neurology. An example of Association for Innovation is a multi-marker test that allows the molecular characterization of tumors of patients with non-small cell lung cancer by means of next-generation massive sequencing. An example of tender by negotiation is a file for 2 batches of virtual reality services, and an example of competitive dialogue is the file of development, service, and demonstration phase of an assistance system for the detection of various pathologies based on image analysis with artificial intelligence techniques. And the future PPI. The future of PPI in our region, we consider that there are a variety of areas to address. For example, the diagnosis of network pathologies, coordination of telemonitoring of chronic pathologies, support for citizens in self-care processes for health, the evaluation of the patient based on the information provided by the patient, coordination and follow-up of patients in the socio-sanitary field care, health data management with research support, and a large, etc., of different variety of areas for the future. And what are the conclusions of the PPI in Galicia? The PPI, first one, the PPI has a great social impact with the contracting authorities, companies, and the society in general. The second one is the products are developed that don't exist in the market, covering the needs of the administration and the needs of the population, the society. Also, small and medium-sized enterprises are is the potential of the small and medium-sized enterprises and job creation are encouraged. Is a collaborative development of R&D, including obtaining royalties and other benefits for the future exploitation of patents. Also, the knowledge transfer between sectors with transparency. And the last one, we think, I think, is a global and inclusive vision with the European Union, for example, with the different funds that we need for the PPI. And that's all. Thank you so much. And this is the consortium. There are the consortium partners: Vega, Civita, Clusters of the Galicia, Technopol, Praxis, and a large, etc. of that. Thank you so much.